overarching principle, the suctioning tongue posture, do you think that the root source of that is breastfeeding and that all of myofunctional therapy is really just an attempt to teach adults what they were supposed to learn through breastfeeding?
Not all breastfeeding, but definitely what we're doing is we're not doing anything abnormal in myofunctional therapy. We're actually kind of fixing missed milestones of what should have been. So, nursing, breastfeeding is the catalyst for good oral facial growth and development. So, a correct nursing pattern is a peristaltic motion. It's kind of like this up, down, almost like the tongue functions like a trampoline. It depresses in the middle, which creates a vacuum of negative pressure to expel the milk. Tongue goes up, a little bit forward, and the milk goes down. So, correct nursing is like myofunctional therapy, right? In infancy, it strengthens the
Hmm.
muscles correctly. If a baby's born with a tongue tie, and I know we'll probably want to talk about tongue tie, that could cause the nursing action to change. And that peristaltic motion can actually become a thrusting piston like motion, which is already setting up the muscles incorrectly for incorrect, like kind of like a tongue thrust. So, nursing is a great thing in and of itself. That's amazing. That's kind of what should occur and what starts to strengthen the muscles correctly. But if there's any other dysfunction, that could override good nursing, like tongue
Hmm.
tie or putting babies on pacifiers or sucking pouches or overuse of bottles, or if a baby's sucking their thumb or finger. I mean, a child is that could totally change everything. So there's not one specific thing that is going to make everything go correct. If
Hmm.
you weren't
Hmm.
nursed, you could still be fine. You know, if you were nursed, you still might not. You might still might have problems.
Hmm.
Um,
Hmm.
this might be a good time for me to share the screen for one
Sure.
thing. So, what I want to
Sure.
share with everybody, and I share this with all of my patients, is when we're looking at the cause of myofunctional disorders and airway problems, we must take into account the interacting role of the three systems: the medical system, the dental system, and the myofunctional system. These three systems work together as a team, and any dysfunction or altered functional pattern in any one of these three systems can affect the others, leading to problems in the oral cavity. So, right now, we're talking about myo, muscle, mouth, that system. And so, issues like mouth breathing or incorrect rest posture, problems chewing where you only chew on one side, or habits like thumb sucking, that can all affect the structures of the mouth. But also, medical factors need to be taken into account, like allergies, chronic sickness, upper respiratory infections can cause you to mouth breathe. Large nasal turbinates, a deviated septum, nasal polyps. If you have large adenoids, large tonsils, frenums like tongue tie, that can
Hmm.
all affect how
Hmm.
the muscles work, right? And then the last is the dental or the skeletal system. So if you have like a palatal torus, like a bony growth on the roof of the mouth, that could impact where the tongue rests. If you have a narrow roof of your mouth, your tongue might not be able to rest up there because it's too narrow to fit the tongue, even though the initial reason why it's narrow is probably because the tongue was low. If your
Hmm.
jaws are too far back, you have an underbite, or upper jaw is really far forward, that can affect how your lips close and makes it more difficult for lip closure. Even appliances like night guards or certain orthodontic appliances like palatal expanders can
Hmm.
impact the tongue's rest posture. So, what we need to do for any patient is assess and treat problems in all three areas for the issue to be resolved. So, when you talked about a lot of people just want expanders, well, you're just treating one circle, but you must also treat the medical components and the muscular components.
Hmm.
And
May I for a second, Nicole?
mhm,
So, can
let me put
let's focus back in on that presentation. Actually, would you mind putting it back up?
sure.
So, I think, and this has been my experience, that if you augment the dental component, if you just make the box bigger, then you can, to some degree, solve medical problems and myofunctional problems passively, right? Like, so if my intermolar width goes from 35 to 40 with a MARPI device, then that makes my nose, my nasal volume bigger. Uh, If my sinuses are a little bit swollen, that's okay because now the box that they're in is a little bit wider. Same with tonsils and adenoids in a deviated septum. That can be relieved by an expanded nasal floor. And then myofunctional system, if I'm having a hard time adopting good tongue posture and I just make my palate bigger, now I don't have to develop those fine skills of tucking the sides of my tongue up into my palate through myofunctional exercises. It just sort of goes up naturally.
No.
What are your thoughts on that?
Oh, sorry. No, no, actually. So some of these issues will be less of an issue when you do make the box bigger. So when you expand the palate, if you have a deviated septum, the septum doesn't straighten out. It just makes it less of an issue, right? There's more
Mm-hmm.
square footage in the nose. So
Mm-hmm.
allergies won't go away, but they're probably the enlargement is going to have less of an impact. You still want to treat the allergies. You might not need to have a septoplasty anymore because your nose breathing might be better,
Mm-hmm.
but the muscles don't know where to rest correctly if they have not been trained.
Mm-hmm.
So research shows in children who get their tonsils and adenoids removed or get an expander or even a tongue tie release, even in adults, the tongue doesn't know, oh, now I'm going to go up. Lips, now I'm going to close because they've never been trained to do so. They don't just automatically do that. So that's
Mm-hmm.
where it's called muscular rehabilitation. After the medical cause of the mouth breathing or low tongue posture is addressed, after the skeletal or dental issues are addressed, muscles must be rehabilitated. And it's not always after, but we have to rehabilitate muscles as part of the process.
Mm-hmm.
If somebody can't breathe through their nose due to enlarged tonsils or enlarged adenoids, then first you need to address the medical cause of the mouth breathing before you rehabilitate the muscles. But the muscles must be rehabilitated.